Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the Korea Disease Control and Prevention Agency on the COVID-19 outbreak. Early in the morning, South Korea reported 110 more COVID-19 cases. That's a slight drop from the previous day, but local infections are still in the triple digits. The briefing is about to begin, so let's take a listen.
First of all, we have Mr. Kwon Junuk with the explanation. Let us now begin our regular briefing on the COVID-19 response for September 19th, Saturday. As of today midnight, we have 106 new local infections and 4 new imported cases. The total caseload now stands at 22,893. 199 more people have been discharged following full recovery, while 2,545 people still are in quarantine. There are 152 patients with severe or critical conditions. We had 1 additional fatality. I extend my deepest condolences to the deceased and the members of the bereaved family. As of noon today, we have some updates on our domestic infections. Here are our data, and please note that these are subject to change depending on the time of data accumulation. First, in the city of Seoul, related to the August 15th Seoul rallies, we have 4 new cases. A total of 613 cases have been confirmed to date. And in Gangnam-gu district, in relation to the Donghun Industry Corporation, we also have the index case being confirmed earlier this month, and we identified 23 more patients, and a total of 24 people have been confirmed to date. And in relation to a group meeting in the metropolitan area, we have 9 new cases being confirmed. In total, 10 cases have been confirmed to date. And in relation to the Severance Hospital in Seodaemun-gu district, we have 2 additional cases being confirmed, and in total, 48 people have been confirmed to date. And moving on to Incheon, in relation to the Hope Church in Michu-Holgu district, we have the first index case being confirmed on the 18th of September, and we have 5 new cases, increasing the total to 6. In relation to Pagewon in Goyang City, Gyeonggi-do Province, which is a mental health care facility, we have 1 additional case being confirmed. A total of 19 people have been confirmed to date. In relation to Kia Motors in Gwangmyeong City, Gyeonggi-do Province, we have 2 additional cases being confirmed. In total, we have 16 cases being confirmed to date. And as for the imported cases today, we have 4 new imported cases. As for the countries, we have 2 from Nepal. And here are some updates on our R&D aspects. First of all, remdesivir. The drug has been administered to around 416 patients across 58 hospitals nationwide. And we also continue to note that the COVID-19 vaccine and therapeutics research are continuously being held. And in order to provide continued support, we have been providing some resources. And up until now, we have received the applications for about 154 institutions, and the given of these species and have been completed to 146. And the major purpose was for the development of the vaccine as well as therapeutics. And going forward, we will provide these samples and our resources possibly so that we could facilitate a faster development of our therapeutics and vaccines. And as for the door-to-door sales facilities, we are experiencing continuous cluster infections. And after mid-August, we have seen that in relation to door-to-door facilities, especially in relation to the business seminars that they have held, we have confirmed that more than 340 people have been confirmed at across 10 facilities. And these were meetings and seminars that were held in closed and contact confined environments where people had to be crowded together, and they also shared meals and snacks together, and hence increasing the risks of infections. And against this backdrop, in order to curb the further spread of the virus, we ask all of these door-to-door facilities to refrain from hosting such seminars and small meetings, and we will also carry out more in-depth crackdown against these facilities. We are mandating all of these door-to-door sales facilities, which are subject under as the high-risk facility, to also ban and suspend operations for the time being, and we ask the senior citizens to refrain from going to these facilities. And as for the safety e-report run by the Safety Ministry, we have the following example, and there was a report on an example of an illegal food truck where people gathered together in crowded places, and also they had payments in cash, meaning it would be very difficult for them to trace the contents. And we once again highlight that during the weekend, we ask for you to refrain from canceling and postponing non-essential travels or gatherings, as well as social meetings. And if you have to step outdoors, please wear your face masks at all times. Moreover, we highlight once again about all of the door-to-door facilities and all of the seminars that they host. These environments could be confined, crowded, and close contact environments, so we ask you to refrain from going to these places. Last but not least, we would also like to note the following. Here in South Korea, COVID-19 continues to hover at around 100 range on a daily basis. However, we are currently continuously to witness a downward trend, while its speed is quite slow. We were able to contain a large spark of the virus. However, we have still sporadic outbreaks here across the nation, and especially in the metropolitan area in Seoul and Incheon and Gyeonggi-do province, we have a high risk of silent spreaders, as well as high proportion of people who are untraceable. And therefore, we will also exert our full efforts to cut the chains of transmissions, especially in these areas. And the quarantine authorities, we are continuing to highlight that we need to have the situation under the control of our society as well as our medical capacity before we have an effective therapeutics and vaccine against the virus. And this is as part of our prolonged and long-term containment policy. We believe that these policies and tactics would also be helpful when we have a combination of the cooperation from the public as well as the medical circles. And we would like to once again highlight the fact that the public citizens are exerting their full efforts to comply with the social distancing. However, this is actually the essence and the core of South Korea's containment efforts and achievements. And we would like to thank you once again for this occasion. And please note that these social distancing measures will also be reflected in the future trends of the outbreak after Chuseok as well. We have been reporting to you like the situations that are unfolding in Europe. However, many experts also see that we have a high risk of outbreak, a massive outbreak that is in the Northern Hemisphere. And just as you did so far, we ask the members of the public to continue to participate in social distancing, and please have perseverance as well, and please wear your face mask and wash your hands on a regular basis. And as for the vaccine development, we have a few words. In 2009, we have experienced the new flu, the H1N1 virus, and we also had we were in the 9th rank of the countries to develop these vaccines, and their doses amounted to about 25 million. And we also categorize a high proportion of our people to be immunized with the flu vaccines. And annually, we also carry out our public immunization campaign. And ahead of the COVID-19, we have abundant amount of expertise and knowledge in the area of vaccine development. However, the COVID-19 situation is ever more serious. Probably we believe that the vaccines will be carried out twice. And if there are some processes of side effects and adverse effects during these vaccinations, that is, we also see a possible halt in such vaccinations and immunization schedules, and all of these schedules will be delayed going forward. And currently, until the day that we have a safe securing of the vaccines, this happens, we will have to note and we will have to monitor the situations of other countries which have more than 500,000 or up to 1 million doses of vaccines, and to see whether there have been any experiences of side effects or adverse effects. And until then, we also can commence our vaccinations here in South Korea. So this means that we need to also highlight the importance of safety before anything else. At the current moment, we believe social distancing measures is the only effective way to contain the virus and flatten the curve going forward. And the quarantine authorities will also do everything it's possible in order to contain the virus going forward. Thank you very much.
There you have it. We'll bring you more details on the briefing in our upcoming newscast at 6 p.m. Korea time. Until then, goodbye.
Behind Korea's successful COVID-19 response were thousands of volunteers